Hey guys, welcome back to another anatomy and physiology video. Today we will be talking about skeletal muscles and their actions in the human body. So I'm going to kind of divide this video up into small segments relating to the different regions of the skeletal muscles, just for my own purposes of organization and to kind of help you guys realize where they are in terms of the body itself and the anatomy of the human. So I'll first focus on the facial muscles. The frontalis are muscles up here. They're near the eyebrow, so they're like right above here. And they're responsible for raising and lowering the eyebrows and kind of wrinkling the forehead. So that's what the frontalis muscles are for. The temporalis muscles are off to the side here. They're responsible for moving the mandible, what's otherwise known as the jaw. So if I opened or closed my mouth, my jaw, up and down, and then kind of moved the jaw off to the side, then the temporalis muscles here are responsible for that jaw movement. And then we have the orbicularis oculi, which are the muscles right around the eye. And their action is primarily helping the eye movement or the muscles around the eye. So if I wanted to squeeze my eyes, wink, or just raise my eyes in general, those are the muscles responsible for that. And specifically, the word oculi kind of hints at the occipital lobe area. Not occipital lobe, but oculi, occipital lobe, they all relate to the eye in itself. Then the orbicularis oris are the muscles around the mouth, and they're responsible for like putting the lips together and the mouth together. So if I did, then the oris muscles are responsible for that. They kind of help control the movement of that mouth. Now the chest muscles, so the first chest muscle that we really need to know of is the pectoralis major. So it's just like where my hand is. That's where the pectoralis major is. And that's really responsible for like flexing the humerus. So if you like throw a ball underhand or you like lift a child, like those muscles are what help the humerus kind of bend in back and forth. Like those muscles are really primarily responsible for that. And, a lot of people lift weights, upper body workout, they lift weights. That's why, the pectoralis major is that region that they're working out. That's why lifting weights is important for the upper body half. It also helps with, the adduction and the internal rotation of that humerus region. Now, the pectoralis minor is the smaller counterpart to the pectoralis major. That's located right about here. It's almost like string fiber muscles, in a sense, coming down here. And that's really responsible for a lot of things relating to the scapula. So the stabilization, the depression, the abduction, the protraction, the internal rotation, and the downward rotation of the scapula. So if your ribs were immobilized, let's say, you held it in one place and you kind of move your arm out, the scapula will go forward because of these pectoralis minor muscles. And then if you held your scapula in place and you kind of like lifted forward, as you can see, my ribs are kind of coming up. So this muscle really helps with bringing the ribs up, especially for deep breathing exercises. If you do deep breaths, then, the ribs lift up, and that's all due to the pectoralis minor muscle. Now, the abdominal wall muscle region really has one muscle we need to focus on, which is the rectus abdominis, which are the ab muscles, essentially. And the action of this muscle is to pull the rib cage and the pelvic bone towards the middle of the abdomen. So, when you're doing a crunch, and you can't really see my whole body here, but when you're doing a crunch, basically that pelvic bone and all those regions around the rib cage kind of fold in that abdomen towards the middle. And so the rectus abdominis muscles, that's what's responsible for it. That's what's pulling everything in towards that center. The next region is the back muscles. So erector spinae. Spinae refers to the spine. So erector spinae would be all the muscles kind of running down along with the spine here. And these muscles are really responsible for a lot of things relating to spinal movement. So if I like bend forward or backward, those muscles are really responsible for moving that spine. It helps laterally flex the back, straighten the back. So if I was hunched over, I wanted to lift back up, these muscles are the reason that my spine are able to come back up and sit in a straight, erect pattern. So let's focus on the upper extremity muscles, which kind of covers that upper half of the body. So the deltoid, which is located around here, that helps with raising the arms, like flexion, so raising the arms to the front of the body, and like abduction, raising the arms to the side of the body. So like abduction really means moving away from the body, moving a limb away from the midline of that body. So if I move my arms out, those deltoids are helping, they're acting and they're kind of helping move those arms out. The trapezius, they're muscles that run along the back here near the scapula, the shoulder blade. They're used to like really tilt and turn the head and neck region. So like they're like right underneath those regions to kind of help with moving that head and neck around. But they also help with like shrugging, steadying the shoulders, and like twisting the arms like in and out like that. The trapezius also elevates and depresses, rotates and retracts the scapula, like I said, the shoulder blade. The supraspinatus is up here as well. That helps with the abduction of the arm at the shoulder joint. So, moving that arm away. And it also pulls the head of the humerus, so like right around here. It kind of pulls it medially towards the glenoid cavity. And like medially means towards the midline, so it kind of helps pull that head of the humerus in. The infraspinatus. So the infraspinatus is a muscle that kind of goes around that scapular region, both on the right and left side of the body. That helps externally rotate the humerus and stabilizes the shoulder joint. So, if I rotate the humerus here, those muscles are responsible for it. They kind of help. When you do this for a long period of time, those muscles in the back start to feel sore. That would be the infraspinatus. The subscapularis, so that's actually a muscle in the relatively same region. That helps rotate the head of the humerus medially and, adducts it. So adduct compared to abduct. Adduct means to move towards the midline of the body. So, when the arm is raised and, it draws a humerus forward and downward, those are so subscapularis, that's part of its actions. That's what it helps with. The teres minor, so that's around, the bottom region of the arm there. It's what laterally rotates the arm. So it's not like exactly on the arm, but like, it's part of this region here. And, laterally rotates that arm. So laterally means away from the body compared to medially. It means away from the body. So that's its main action. The supraspinatus, infraspinatus, subscapularis, and the teres minor, they're all part of rotator cuff muscles. Those four muscles specifically. Those help with kind of the rotation of the arm in general. The biceps brachii and the triceps brachii. So when we say biceps, there's a huge clump of muscle in the arm here. It's towards the middle, the biceps. So like when I flex, the middle here is a biceps. Biceps brachii helps flex the forearm at the elbow joint. So it doesn't only extend here. It goes down a little bit. And that helps, flex that forearm at the elbow joint. So a lot of people, when they're flexing and say, look at my biceps, that's because these biceps here show themselves more sharply when you're flexing, when you're bending. So then you have the biceps brachii show up. And when the triceps brachii is actually kind of the opposite. So like when you're extending your arm, those muscles that are like pulling on the outside of that arm there, that's the triceps brachii. That kind of helps extend that forearm, which allows the straightening of the arm at the shoulder joint. So, you know, if I do this, you know, kind of pulls it out. Flexors, basically, you know, it's a contraction, bends at a joint, decreases the angle between the components of a limb. So if I have my arm here, flexor, flex, bend, decreases that angle to like, let's say 90 degrees, 180, 180 to 90, that's flexed. Extensors are the opposite. So as you can tell by the name, extensors basically means to extend. So basically to increase that angle. So go from that 90 degrees, then go to 180. You're straightening the muscle in comparison to bending it. You're increasing that angle between limbs. So those are really the most important upper extremity muscles that you need to keep in mind when you're reviewing skeletal muscles. And those are their actions. All right, guys. So for lower extremity muscles, I'm going to have to move this down to kind of explain the leg here. So really, let's start off with the sartorius. So the sartorius kind of comes up to the hip here and it goes down. And really this flexes, abducts, and laterally rotates the thigh at the hip. So like at the hip, it can flex, abduct, and laterally rotate that thigh. It moves the hip joint and the knee joint. Those are its primary actions. Now the gracilis is a muscle that's really, really thin. And, you know, you can kind of see that it's a really, really thin muscle, like spanning the leg here. And gracilis is a muscle really found near the groin area, and it's responsible for hip adduction and assists with knee flexion, so like bending the knee. Then you have the adductor longus, which is a really large muscle, kind of just running, not large, but it kind of runs near that gracilis. It's like right next to that gracilis. And that really helps with adducting, moving that limb towards that midline, towards the thigh at the hip joint. And it adducts and medially rotates that hip. Then you got the rectus femoris. And the rectus femoris is one of those larger muscles. And it's right around here. And that rectus femoris, that helps with, you know, flexing the thigh. And it's also the muscle that can flex the hip. And, you know, since when you flex the thigh, basically you bend it, all of those sorts, you kind of increase the tone of that muscle there. So that rectus femoris is kind of responsible for that. Now, the gluteus maximus is obviously the butt, and that's really to help actually perform knee flexion and laterally rotate that knee. And then you got the gastrocnemius, which is part of like a two system in this calf region. So the gastrocnemius is like one half of the calf here. It's like normally found at the top of this calf, and that's primarily involved in running, jumping, and other fast movements of the leg. And to a lesser degree, it helps with walking and standing. But, you know, the function of this is plantar flexing the foot at the ankle joint and, like, flexing that leg at the knee joint. So, like, when you're running, like, those muscles are active there. They really help with that. The next muscle would be the soleus. Soleus is really that. It's the other half of that calf muscle. These really work together to form the gastrocnemius, and the soleus work together to form the Achilles tendon running to this back here. The soleus helps with plantar flexion of the foot. And so really like increasing that angle between the foot and the leg itself, ankle, foot, leg. all of those. And then the tibialis anterior. It kind of acts to dorsiflex and invert the foot. So like when I move my feet in like this, that's what the tibialis anterior action is. That's what it helps with. So it's a little awkward position, but basically flexing the foot inward like that. So those are the major skeletal muscles. I hope you guys learned something from this video, and if you ever have a question relating to a medical term, you can always search it up. I know I didn't clarify everything. I tried to, but didn't cover as much of the definitions as I wanted to. But feel free to look into it yourself if you want. Ask any questions and comments, and hopefully you enjoy these videos. So see y'all next time.